Thin fluid, urine, can get through small spaces much easier than a solid catheter, camera, etc. can. Drinking water is easy, but swallowing ice cubes is not and can hurt your throat because it's constricting around something rigid. I've had a camera up my dick. A cystoscopy. The camera isn't a GoPro. It's smaller than a pencil and you'd be surprised what they can fit in your dick hole. It's not very painful and afterwards there is not much pain. Probably similar to getting soap in your dick hole. Just a little discomfort, which is gone fairly quickly. I was scared to death, but in the end it was really nothing to sweat and they got to see all the way to my ureters. And I'm not dying. That's my experience. It hurts to pee when you have an irritation in your urethra. I have experienced these sources of pain when peeing. Urinary tract infection. UTI. Post-op after kidney stone removal. The catheter or endoscope inserted up the urethra leaves a bruise inside that hurts for a few days. And the pain is intense the first day. Passing a kidney stone fragment. Feels like a UTI. Hurts for about half a day. Another pee pain. The first knuckle of my left thumb hurts when I pee. This sensation developed about 10 years ago. I thought it was weird. Then actually found a forum discussion involving people with the same problem. Saying, yeah, my doctor has no clue what's going on. I told my doctor and he said, you got me. I have no clue either. Quote, because urine is liquid so it just flows. Whenever there's a medical procedure it implies something solid poking the most sensitive part of your body. Drinking water is easy. Shoving a tube down your throat knows so much. Same principle. Removed. If the urethra gets stretched out enough that there are micro tears inside. This is pretty easy to do. It is very delicate. Then yes, it's gonna burn when you pee. There is salt in your urine and it aggravates your pain receptors. And the pressure of the urine will slightly expand the urethra, opening those micro tears to the salt in your pee. Removed. When you pee, you're actually relaxing the muscle that holds your pee in, so to speak, so it's able to flow freely without resistance. Removed. In my fluid mechanics class, when we learned about laminar and turbulent flow, my professor told us that our urethra evolved to a certain geometric ratio so as to maintain laminar flow. All animals, no matter how big, piss with laminar flow. He also said that the reason why vomiting hurts is in part due to the flow being turbulent. The most painful event in my life, 10 out of 10, was the insertion of a Foley catheter when I was suffering from septic shock. It felt as if someone was pushing barbed wire through my urethra. I wanted to crawl away from the gurney. That said, I want to reassure those who might be in a situation when a Foley catheter needs to be introduced. It normally doesn't hurt. This was a special circumstance and I suspect that it was at least partially caused by inexperience in the part of the nurse. When you pee, the urine that's touching your urethra doesn't move that fast. If you ever note, the most uncomfortable moment of peeing is when you start. After that, things feel like no big deal. What happens is that the molecules of urine that touch your body may have high friction. Those molecules, though, just stop. The main flow of the urine checks those stopped molecules that create a cushion. All the rubbing happens between the urine molecules and not your body. When a solid object is inserted, they use some lubricant, but it's not perfect. A liquid will always deform and separate as needed to not rub too much against the walls of the container. A solid object will rub directly, causing a lot of discomfort. The bladder is more of an exit-only type of organ, meaning it's built to have stuff come out of it, and not built to really have things put in. Cameras are going the wrong way. And a camera is a solid object while pee is a liquid. I'd just like to point out that I insert around 3 catheters a day at work on average. For the most part, it doesn't actually hurt that much. It can be uncomfortable, but by and large it doesn't cause a tremendous amount of pain. There are definitely some people that have a hard time with it. But for the most part, those people tend to have a large amount of anxiety to start with, which seems to be the biggest contributor to any pain that is felt when you get stuff put in your urethra. But this can also happen to your throat, trachea when you get intubated. You get scratches and tears in your urethra because it's narrow and stuff isn't supposed to go in through there. When those scratches come in contact with urine, they start to hurt. Like your 5? Solids scrape, liquid flows, and at reasonable speeds doesn't hurt. Like your greater than 5, the liquid doesn't all push through along the sides, it probably expands the vessel with pressure and the flow isn't really touching the wall. Think of blowing up a balloon, animal balloon. The long thin ones. I've had several procedures where they had to go in via the urethra. There are 2 main reasons it is uncomfortable and may hurt while urine coming out does not. The first is simply lubrication. Urine doesn't require lubrication to come out. It just flows across the surface of the urethra. It is soft and shapeless and doesn't offer much friction. Sending something solid in requires lubrication or it will snag and scrape on the surface of the urethra. The doctor will inject a lubricate and numbing agent to help overcome this issue. Of course, he does it by stuffing the dispenser in, which means putting the lubrication and numbing agent in is itself uncomfortable. The second is there are sphincter muscles that need to be passed through. When you urinate, it comes out because your body relaxes those muscles and opens them up. We don't typically have the ability to relax them on demand for something to go in backwards. That means the doctor needs to forcibly shove through the sphincter, which will be trying to remain closed and will squeezing against the item passed in. This can be very uncomfortable and sometimes painful. These are not muscles that experience this kind of an event ever, so the nerves are not used to it. They signal to the brain something is very wrong, which the brain interprets as pain. Curl your fingers to touch your thumb and then find a hard object about that same diameter. Now close your fist tight, and while keeping it as tightly closed as you can, ram that object into your fist to force your fingers open. Without lubrication, this is going to either fail entirely or hurt a lot. Now add lubrication and try again. You probably won't fail this time. But while the object is in your hand, continue to try to squeeze your fist shut as hard as you can around the object. You will quickly find the muscles in your hand start to cramp, and trying to squeeze against it is uncomfortable or painful. This is what is going on with the sphincter muscle between your urethra and bladder that holds back your urine. I've had a catheter in the past and it didn't hurt going in or out. Maybe uncomfortable, but not as bad as the pain of a full bladder and not being able to pee. I've had a camera up there. Cystoscopy is what the procedure is called. And to be fair, going through the urethra wasn't that bad. Just uncomfortable. When it had to go through the prostate though, my word, that hurt. The camera doesn't hurt. I've had it done several times. It's mostly just a weird pressure being applied and they use lube. I had a urethroplasty surgery. They replaced a part of my urethra with a graft from the inside cheek in my mouth. The most painful part of the surgery was my mouth. The cameras and catheters were never really painful. And peeing after having the camera or catheter removed was just very minor irritation. It hurt like absolute hell when I peed when I was having my problem. Though, I had scar tissue building up in my urethra and it was blocking the flow. The doctors said the pain was worse than the pain while passing a kidney stone. It was causing my kidneys to start to fail also. Removed. I've had scopes up my urethra because of my kidney problem. They always gave me these tiny orange pills that were supposed to help ease the pain. They didn't ease any pain. It burned like crazy. And all they did was turn my pee a bright orange. Pee is a fluid, which conforms to the shape of the urethra. A camera is a non-fluid, which means the urethra conforms to it. It's the difference between wearing a sweater and being worn as a sweater. Does it hurt to pee? Is it hard to breathe? I am diagnosing you with HPV. Removed. Removed. Real question you should be asking is why it doesn't hurt to shit, because fluids take the shape of their container and don't really stress the urethra much. Actual Eli 5. Pee doesn't scratch, poke, or stretch your urethra. Inserting things does. And even when careful, the stretch will hurt. Bodies aren't built to register normal activities as painful, for the most part. Thankfully. It's like asking why isn't your smoke detector set to go off every time you run your toaster. As a kid I had bladder issues and was examined 3 times in 3 months. The first couple of days after the procedure did indeed hurt like hell. I don't remember it being more than 2 or maybe 3 days, then all goes back to normal. This is my experience, yours may be different. If you've ever seen a cystoscope, rigid or flexible, you'd immediately know why. But long story short, cameras aren't supposed to go up your pee hole, we make them though. I'm not sure what you mean. Is it not supposed to burn when I pee? Peesh, next thing you're gonna tell me is pee ain't red face with rolling eyes. One thing. The faster a fluid moves, the lower the pressure. That's partially why it hurts when you don't pee. And it feels better when you do. That might not answer your entire question. But it's a key piece of the puzzle. It does hurt to pee, a little. It also feels nice, a little. You get piss shivers because of it. It did, for a long time. Also repeated Eutis. And a baffled doctor telling me it's not normal to have a 20-minute long pee or repeated Eutis for a 26-year-old male. 2 ultrasounds. A CT scan. 3 urologist visits and a surgery later, and it turns out scar tissue can be very, very bad for you. Because one is a liquid, and the other is a solid, dude. A good way to think about it is life evolved to survive and pass on genetics, so making a normal bodily function cause pain is counterproductive to the goal of life. Why does a shower of rocks hurt while a shower of water doesn't? My dad has bladder cancer that returned several times. It does indeed for him to pee. All the time. // Removed. Peeing can be uncomfortable sometimes. If I really have to go badly and it's really dry outside, it feels like the skin is getting rubbed before the flow begins. Ugh. Removed. 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 Yeah, that makes sense, lol. Sorry about the dumb question. Thank you. Greater than drinking water is easy, but swallowing ice cubes is not. Why is this my new favorite phrase? Also, those cameras are unreasonably wide. It's like the diameter of a pencil. So not fun, though I assume they'd make them narrower if they could. Just to put what you said in slightly different terms. A thin fluid, urine, will take the shape of the urethra. The camera will force the urethra to take the camera's shape. Greater than drinking water is easy. Tell this to my friend who can't stomach water and is so used to drinking things like soda he can only drink water if it has flavorings in it. Which is also why when you get some solids, kidney stone, in your pee it hurts a lot. You'd be surprised what they can fit in your dick hole, is such a banger phrase, I fucking love it. Greater than cystoscopy. It's not very painful and afterwards there is not much pain. Probably similar to getting soap in your dick hole. For me it was the worst pain I ever felt in my life. After 5 other surgeries and many things. And the first pee afterwards was hell as well. Just the lubricant you get in there before putting in the camera hurt way more than a bit of soap. Brother, you are lucky. I had a cystoscopy done. Which turned out to be pointless because my issues are due to pelvic floor issues. And it was the most intense pain I had ever experienced. Everyone is definitely different and I am very jealous that you didn't have much discomfort. I had the same experience as you both times I had to have it done. It was extremely uncomfortable but not really painful. Maybe my experience was colored by the fact that I got it done as the final step in removing kidney stones, which were insanely painful, though. That's pretty interesting. I've never heard dick hole used twice in one paragraph before. The replies here are interesting. I have done this many times. And I have one coming up that I am scared about. When I think about why I am scared, my mind goes to it's painful. However, if I really think back to the past experiences, was it really painful, or just uncomfortable? I think perhaps people remember it as pain, when it really wasn't, or people really do experience it differently. They do shoot freezing stuff up there first, so it really shouldn't be horrible. I don't know. Man, my cystoscopy was painful as fuck. I'm very grateful to the nurse who let me hold her hand and rabble shit at her to distract me. Maybe I've just got a tiny dick though. Who knows? Person shrugging. As someone who had a cystoscopy this week, I do not agree with your statement fully. Everything up to getting past the prostate was plain sailing, and then I was frozen until they got that thing out of me. Also, the numbing gel stung like a MF when it went in. Your doc has probably already considered it, but the nerves from the spine to the thumb area are typically associated with the C6 level of the neck. Could the pain in the thumb be from a combination of a craning your head down to aim and/or b some mild muscle contracture between the shoulder blades as you urinate? That could cause brief situational pressure on the nerves at the base of the neck that go to the thumbs, that one might only notice when they're peeing. You could test that theory by trying different positions. If your shoulders are typically rolled forward when you pee, try rolling them back and see if that helps. Or after you start, tilt your head back up and see if that helps. If you typically aim with one hand, try using the other, etc. There is a forum for P-thumb people? ? I'm sorry that you experienced that. Slightly uneducated guess, but nerves are really weird. From doing foot acupuncture curing things elsewhere, to something simple as feeling a belly button poke in your nethers. Bodies are weird, so I'd have to guess it's some nerve not wired quite right. I've had kidney stones. They hurt quite a bit. There is some research that lemons help prevent stone formation and reduce their size. Thank you for the answer. Makes sense lol. Right? Next they're going to say that it isn't supposed to make a loud screaming sound when peeing. Please read this entire message. Your comment has been removed for the following reasons. Asterisk. Top level comments. http www.reddit.com/r/explainlikeme5/wiki/top_level_comment, i.e. comments that are direct replies to the main thread, are reserved for explanations to the op or follow up on topic questions. Rule 3. Joke-only comments, while allowed elsewhere in the thread, may not exist at the top level. If you would like this removal reviewed, please read the detailed rules. https www.reddit.com/r/explainlikeme5/wiki/detailed_rules. First asterisk if you believe it was removed erroneously. Explain why using this form. https old.reddit.com/message/compose 2 equals %2fr%2 explainlikeme5 and subject equals please %20 review %20 my %20 submission %20 removal and message equals link %20 https old.reddit.com/r/explainlikeme5/1fjj6x1//lanoxin/%0a%201:20 does %20 comment %20 pass %20 rule %201 %20 %0a% 202 %20 if %20 your %20 comment %20 was %20 mistakenly %20 removed %20 as %20 and %20 anecdote %20 short %20 answer %20 guess, %20 or %20 another %20 aspect %20 of %20 rules %203 %20 or %208 %20 please %20 expla in, and we will review your submission. Asterisk. Please read this entire message. Dash dash dash. Your comment has been removed for the following reasons. Asterisk. Top level comments. http www.reddit.com/r/explainlikame5/wiki/top_level_comment, i.e. comments that are direct replies to the main thread, are reserved for explanations to the op or follow up on topic questions. Rule 3.